high blood pressure is not a disease. A normal BP reading should be within 120/80. If you are somebody that is having issues with high blood pressure, foods that are rich in potassium will actually lower the sodium level. Sodium is one of the minerals that increases the blood volume of the blood and thereby increasing the blood pressure. I will be discussing on how to use your NLS device to trace the root cause of high blood pressure with your patients. There are other home therapies that you can actually practice, like what I call onion therapy. We have the white onion ball and we have the purple onion ball. I'm talking about the purple onion ball. You see that outermost part that you usually throw away? It is high in quercetin. Wash it well with likes of apple cider vinegar, blend the whole bulb, take away the rough edges, and drink the juice that comes out of it. That will crash high BP in the body within 3 to 5 days. For those of us, especially for men, who have been taking synthetic medication for BP, you may get your BP lowered, but if you continue like this for years, the side effect is that it may land you in a case of erectile dysfunction. The main function of the parathyroid gland is to regulate calcium level in the blood. Now, a situation where one of the parathyroid gland develops a tumor, what will happen is it is going to cause an over-secretion of the parathyroid hormone. The parathyroid gland is the gland responsible for secreting the parathyroid hormone. And the parathyroid hormone plays an important role in regulating calcium level within the blood. If the calcium level within the blood is increased on account of a tumor in the parathyroid glands, it means there will be an overproduction of calcium within the bloodstream. So when there's an overproduction of parathyroid hormone, this excess parathyroid hormone, PTH, travels from the blood to the bones. And when it's to the bones, it will activate the osteoclast cells to come to play. In the bones, we have what we call bone remodeling. That is a breakdown and build up of bones. Okay, that's a remodeling process that happens from time to time. Okay, and it comprises of the activities of the osteoblast cells and the osteoclast cells. The osteoblast cells are responsible for the building up of bones, and the osteoclast cells are responsible for the breakdown of bones. But in this situation, what happens is the osteoclast cells are activated to come to play, and they begin to break down the bones. When this breaking down of bones comes to play, calcium level increases in the blood. When this calcium levels increases in the blood, they begin to precipitate around the walls of the blood vessels, like the arteries, and this is what causes the arteries to get hardened. When they get hardened, they in turn will increase pressure of blood because it becomes less elastic, and because they become less elastic, then high blood pressure comes to play. If there's a malfunction in the kidney, if the kidney is not performing well, then the aldosterone level will always be higher than normal. What is the function of the aldosterone? The aldosterone is a hormone that is released to trigger reabsorption of sodium into the bloodstream. And anywhere sodium goes, water goes. When water follows sodium, the blood volume increases, thereby increasing the blood pressure. That is how the person begins to experience high blood pressure. I'm looking for arteriosclerosis. Can you see it here? Can you see it here? Arteriosclerosis, talking about hardening of the arteries. Okay, look at what I discussed about aldosterone level in the blood. Aldosterone level in the blood. Okay, if you remember what I said about how the adrenal gland will trigger the secretion of aldosterone in the blood, thereby increasing the sodium level, thereby increasing the blood level, thereby increasing the blood pressure level. There are other hormones, steroid hormones, that also regulate blood pressure. So if there's a malfunction, it may affect or it may lead to high blood pressure. When it comes to interpretation, you will need to subscribe for my NLS online masterclass course to be able to know how to interpret such results. Then I even mentioned practical home remedies that you can use to actually manage high blood pressure. Now, if you even want to know more on how to treat high blood pressure and say goodbye to it, then you need to also subscribe for my online masterclass course in natural medicine, where we have several lecturers that discuss nothing less than 10 different herbs, that's in different plants, that you can use to treat high blood pressure and say goodbye to it. Not just the plants, the how to prepare it, everything about the whole process, you will learn from it if you subscribe from my online masterclass course in natural medicine. If you want to subscribe from my online masterclass course in natural medicine, put it down in the comment section. I want to subscribe for the natural medicine online masterclass course. Then I will guide you on how to go about that. And if you want to subscribe for my NLS online masterclass course, type in the comment section, I want to subscribe, and I will guide you on how to go about that. Alright, today I will be discussing on how to use your NLS device to trace the root cause of high blood pressure with your patients. How to use your NLS device to trace the root cause of high blood pressure, I mean hypertension, with your NLS device, with your 𝗵𝗲𝗋𝗏 device, with your biofeedback tracker device, and so on. Your 3D, your 9D, your 17D, your 19D, where to check, parameters you can check to trace the root cause of high blood pressure. Actually, you can trace the root cause of high blood pressure with your NLS device. Many people don't know that, but you need to understand some foundational knowledge of how this comes about before you can know where to check in your NLS device, right? Having said that, I need to establish the fact that high blood pressure is not a disease. High blood pressure is not a disease. It is like a symptom or an indicator trying to warn you of an underlying problem. It's an indicator trying to warn you of an underlying problem. There are several factors that could cause high blood pressure. As a matter of fact, I have seen people that I know, or celebrities. I remember a particular time last year, several known people were just slumping down and dying. And a number of them were traceable to high BP crisis. High BP crisis. Okay? There are many people that are living with high blood pressure as a situation that they found themselves in. And I've come to announce to you that it is actually possible to be BP free. This is not what this video is all about, but I will drop some few tips. I'll drop some few tips that you can practice at home that will help you to manage high blood pressure situation. Okay, high blood pressure is a situation whereby there is so much pressure on the arteries of the blood vessels. So much pressure on the arteries of the blood vessels, and that can lead to cardiovascular problems. Okay, now if you take your BP monitor, your blood pressure monitor, your sphygmomanometer, if the systolic reading is above 140 and the diastolic reading is above 90, then it is considered to be a case of high BP. All right, a normal BP reading should be within 120/80. Although World Health Organization has pushed it higher for elderly people, that okay, if it's on 130/80 something, it is normal for aged people. All right, but on a normal day, under standard temperature and pressure, 120/80 is the healthy place to be when it comes to your BP readings. Okay, so now having said this, let me just quickly drop a few tips before I go into my video. If you are somebody that is having issues with high blood pressure, then you will want to take foods that are rich in potassium. Foods that are rich in potassium will actually lower the sodium level. Sodium is one of the minerals that increases the blood volume of the blood and thereby increasing the blood pressure. All right, so you want to take something that will always drop down the sodium level within the bloodstream. Examples of such are banana, potatoes, citrus fruits, and so on. Then there are other home therapies that you can actually practice, like what I call onion therapy. You know, we have the white onion ball and we have the purple onion ball. I'm talking about the purple onion ball. You see that outermost part that we usually throw away? It is high in quercetin. So I rather advise you wash it well with likes of apple cider vinegar, blend the whole bulb, take away the rough edges, and drink the juice that comes out of it. That will crash high BP. That will crash high BP in the body within 3 to 5 days. Okay, so if you find yourself in such situation, an onion therapy can quickly arrest the situation. Another fruit that is very excellent in crashing high BP is the seed of avocado pear. You can turn it into a tea and take. As you take it, it's going to drop high blood pressure. Okay, but if you want a cure for it, to say goodbye to it, I actually have herbal remedies that I use for my own practice. And within a period of time, when you take it, you will say bye-bye to it. If you need it, you can contact me. All right, but that's not what my video is all about today. Okay, let me drop another tip. Some of you are actually been taking certain herbal remedies for high BP and you are not really getting results. Let me give you an advice. Try detoxifying. Detoxify the body, do proper detoxification program, and try it again. Then you may get a better result. For some people, that has been the issue. They are taking BP meds and they are not getting results. But if you go and detoxify your body properly, try it again, you may get a better result. Let me say this. For those of us, especially for men, who have been taking synthetic medication for BP, you may get your BP lowered, but if you continue like this for years, there are some of those synthetic drugs for managing high BP that if you take them for years, for a very long time, the side effect is that you eventually discover that it may land you in a case of erectile dysfunction. I'm talking from the experience of a consultant. I've had nothing less than 5 to 7 different patients who have actually admitted that they have become impotent. And if you check, it's traceable to long use of some of these most powerful and most effective synthetic drugs for lowering high blood pressure. All right, I would rather you go through the natural approach. Okay, and if you are trying to marry the two, you do a gradual withdrawal. Okay, until your system gets accustomed to the natural herbal remedy, until the body is totally free from high blood pressure condition. All right, I said let me drop that out there. Okay, one more practice is your diet. Your diet. Take for example the most popular table salt that we know is high in sodium. It is high in sodium, even though it's rich in iodine, but it is high in sodium. And anything that has to do with increase in sodium will be increasing the blood volume, thereby increasing the blood pressure. So you will not want to have that in your system. So I would rather advise you to replace your table salt with sea salt. As a matter of fact, sea salt regulates blood pressure. Okay, sea salt regulates blood pressure, so it's also going to be helpful when it comes to managing high BP issues. I just dropped all this information I just gave you. I'm not supposed to drop it, but I'm just trying to save lives. Okay, that's my own little contribution to the world out there. I want to believe that it's going to save a few lives. But let's look at the root cause of high blood pressure. Okay, Let me start with talking about arteriosclerosis. Arteriosclerosis is speaking of a condition whereby your blood vessels, like the arteries, are getting hardened. When they are hardened, it increases the pressure. Okay? Take for example, assuming this is a blood vessel, or this is a hose. If I squeeze this in, I'm increasing, and there's a pump that is pumping water, I'm increasing the pressure coming out of this hose. That's what happens when it comes to blood pressure. All right? The arteriosclerosis is a situation whereby the walls, the diameters of the blood vessels are hardening. When they're hardening, it becomes less elastic. So when blood is passing through it, it doesn't expand enough. And if it doesn't expand enough, then it is, and yet the heart is pumping, it's going to cause the pressure to be higher. Okay? So there are certain factors that lead to arteriosclerosis. Okay? I will show you the NLS device where you can detect arteriosclerosis. Arteriosclerosis is a major factor that leads to high blood pressure. So I will show you somewhere in the NLS device where you can detect arteriosclerosis. Okay, when it comes to interpretation, you will need to subscribe for my NLS online masterclass course to be able to know how to interpret such results. Then I even mentioned practical home remedies that you can use to actually manage high blood pressure. Now, if you even want to know more on how to treat high blood pressure and say goodbye to it, then you need to also subscribe for my online masterclass course in natural medicine, where we have several lecturers that discuss nothing less than 10 different herbs, as in different plants, that you can use to treat high blood pressure and say goodbye to it. Not just the plants, how to prepare it, everything about the whole process, you will learn from it if you subscribe for my online masterclass course in natural medicine. If you want to subscribe for my online masterclass course in natural medicine, put it down in the comment section. I want to subscribe for the natural medicine online masterclass course. Then I will guide you on how to go about that. And if you want to subscribe for my NLS online masterclass course, type in the comment section, I want to subscribe, and I will guide you on how to go about that. Okay, so we are talking about arteriosclerosis. Now, how does arteriosclerosis come about? One of the root causes of arteriosclerosis is stemmed from a tumor found in the parathyroid gland. Tumor found in the parathyroid gland. Okay, as you are looking at the screen, you are seeing the image of the parathyroid gland, but you see this is the thyroid gland. This is the thyroid gland, okay, like this butterfly shape, what we call Adam's apple. Now, in this thyroid gland, there are about 4 there that are referring to, or that contains the parathyroid gland. And what is the main function of the parathyroid gland? The main function of the parathyroid gland is to regulate calcium level in the blood. Calcium level in the blood. Now, a situation whereby one of the parathyroid gland develops a tumor. What will happen is this: it is going to cause an over-secretion of the parathyroid hormone. Okay, I forgot to mention that the parathyroid gland is the gland responsible for secreting the parathyroid hormone. And the parathyroid hormone plays an important role in regulating calcium level within the blood. All right? So, if the calcium level within the blood is increased on account of a tumor in the parathyroid gland, it needs to be an overproduction of calcium within the bloodstream. Okay, so when there's an overproduction of parathyroid hormone, this excess parathyroid hormone, PTH, travels from the blood to the bones. And when it gets to the bones, it will activate the osteoclast cells to come to play. You know what in the bones we have what we call bone remodeling. That is a breakdown and build up of bones. Okay, that's a remodeling process that happens from time to time. Okay, so and it comprises of the activities of the osteoblast cells and the osteoclast cells. The osteoblast cells are responsible for the building up of bones, and the osteoclast cells are responsible for the breakdown of bones. But in this situation, what happens is the osteoclast cells are activated to come to play, and they'll begin to break down the bones. When this breaking down of bones comes to play, calcium level increases in the blood. When this calcium levels increases in the blood, they begin to precipitate around the walls of the blood vessels, like the arteries, and this is what causes the arteries to get hardened. When they get hardened, they in turn will increase pressure of blood, because it becomes less elastic, and because they become less elastic, then high blood pressure comes to play. So you see how arteriosclerosis can lead to high blood pressure, right? Now you understand this. If you get to your NLS device, if you see arteriosclerosis flagging red, then you can now trace it as one of the root cause of high blood pressure, or that could be the root cause of high blood pressure in your patient. So for you to fix that, it means you need to do what you need to do to get away or to get rid of the plaque, to get rid of the excess calcium that has hardened the blood vessels, correct that problem, and the person recovers from experiencing hypertension. The second root cause of high blood pressure that I would like to discuss in this video is kidney disease. Kidney disease is another root cause that can be traceable to the reason why the person is experiencing high blood pressure. What is the function of the kidney? If the kidney is not carrying out its function properly, it may land the person to start experiencing high BP, hypertension. Okay. Now let me explain further. Okay, so you know the adrenal glands. The adrenal glands, they are like caps on our kidneys, like you can see on the screen. Now, this is how it affects high BP. Whenever the body experiences one form of stress or the other, let's say a pathological stress or emotional stress or an emergency, let's say there's a gunshot or there's a lion out there or something that makes one to have to start running or whatever, the body receives an impulse. That impulse triggers the hypothalamus, somewhere in the brain, to send signal to the anterior pituitary gland to release certain hormone called adrenocorticotropic hormones, that's ACTH. Okay, now this adrenocorticotropic hormones is the one that sends information. Hormones are chemicals in the body that act as messengers to go and deliver information somewhere in the body. All right, so that's what I was talking about. Whenever there's a stress, a pathological stress, an emotional stress, a physical stress, it releases an impulse into the body that triggers the hypothalamus via the nervous system to go and send signal to the anterior pituitary gland to release the adrenocorticotropic hormones, ACTH. Now, this ACTH jumps into the bloodstreams and travels down to the adrenal gland, those caps that you see on the kidneys. Okay, and when it gets there, it triggers the release or the secretion of certain steroid hormones. the release of certain steroid hormones like aldosterone. That's where I'm going to, aldosterone. So your NLS device, you will want to be checking for the aldosterone level. You want to be checking for the aldosterone level. What is making the aldosterone level to be higher than normal all the time is traceable to the root cause of the problem. If there's a malfunction in the kidney, if the kidney is not performing well, then the aldosterone level will always be higher than normal. What is the function of the aldosterone? The aldosterone is a hormone that is released to trigger reabsorption of sodium into the bloodstream. Usually on a normal day under standard temperature and pressure, our sodium should be locking in somewhere within our body cells, within our connective tissues, within our muscles, and so on. But when there's a stress, the adrenal gland will trigger this aldosterone level to come back to the bloodstream. And anywhere sodium goes, water goes. When water follows sodium, the blood volume increases, thereby increasing the blood pressure. That is how the person begins to experience high blood pressure. That's how the person begins to experience high blood pressure. Now, if the kidney is malfunctioning, then this is how the person will always be experiencing electrolyte imbalance. Because the sodium level, if it is always high within the bloodstream, it is going to be causing high blood pressure. So you will want to be checking under the biochemical parameters for certain hormonal level, one of which is the aldosterone level, another one is the renin level, another one is the angiotensin level. We have angiotensin 1, angiotensin 2. You will find all these under the biochemical parameters in your NLS device. I'm going to demonstrate it for you. Okay, these are factors that regulate blood pressure. So if the kidney is not filtering well, let's say there's a problem with the kidney and it's no longer filtering well, then it will not release blood as it ought to. Okay, this is also why some people may be experiencing low blood pressure. Okay, when there's a blockage or when there's a tumor, when there's a kidney damage or so on. These are the factors that lead to high blood pressure. All right, so if there's a kidney malfunction, then take for example CKD, chronic kidney disease. Okay, so when you get your NLS device, there are under, let's say, if you pick the kidney organ, you are looking at a list of diseases or pathologies that could manifest. Okay, that could rather lead to electrolyte imbalance. All right, aldosterone level being higher than normal, aldosterone level in the blood, aldosterone level in the urine, and so on. If it is always higher than normal each time you check, that is the root cause of hypertension. Because what will happen there is indicating that the adrenal gland is malfunctioning or the kidney is malfunctioning. All right, when there is a tumor, it will cause an overproduction of aldosterone level, which will in turn lead to high blood pressure. So if you check your NLS device and the person is experiencing aldosteroma of the adrenals, it can lead to high blood pressure. If the person is experiencing polycystic dysplasia of kidney, it can lead to high blood pressure. If the person is experiencing 𝗘𝗡𝗅, that is that's a steroid hormone, 𝗘𝗡𝗅, it's like talking about a tumor on the mineralocorticoids, okay? Then the person is likely to experience inflammation, and this inflammation will trigger an immune response which will cause a release. You know, when there's an increase in blood volume, an increase in sodium, the idea is to push this blood into the muscle so that if the person needs to fight, if the person needs to fly, if the person needs to run away, there is enough blood there's enough sodium, there's enough energy to carry out this. All right, these are the kind of stress that when it stays there for a long time in the body, it will now lead to cardiovascular disease. What am I trying to say in essence? Cardiovascular disease may be also an underlying cause of high blood pressure. All right, but that's not what we're looking at into today. So you are checking your NLS for aldosteroma of the adrenals, you are checking for polycystic dysplasia of the kidney, you are checking for corticostroma, you are checking for fibroma of the adrenals, you are checking for idiopathic hypertension. Idiopathic hypertension is a situation whereby the root cause of hypertension is unknown. You can actually see that in your NLS device. So let's look at the screen where I will be demonstrating practically how to detect or where to check in your NLS device for all these parameters or disease names that I have mentioned. When it comes to interpretation, go and subscribe for my online masterclass on the NLS device, and you will know how to interpret. Even all these hormonal parameters that I mentioned, you need to know how to interpret such results when you see them. Okay, if you want to learn how to interpret such results, subscribe for my online masterclass, and you are going to be saving lives. There are a lot you can learn from the NLS device. So you just need to subscribe. And once you subscribe, you are my student for life. You can ask me questions through WhatsApp, chat me up, give me a call, and you will learn a lot beyond the subscription. And to help you to be in command of your practice, you will save a lot of lives and you're going to earn more. All right. So let's look into the screen, and where I'll be demonstrating on where to check to see some of these disease names, some of these hormone parameters that I earlier mentioned. All right, so I want to show you where to check for arteriosclerosis with your NLS device. I explained earlier on how arteriosclerosis can be traceable to a root cause of high BP. So the organ I selected is heart. Okay, heart from the front, anything heart, and I click on the test button. Then I click on pathomorphology. As I click on pathomorphology, I do my adjustment, adjust all, and then can you see? Okay, let me do my auto scan to generate the entropy results. Okay. Alright, let me pause this video so it's not too long. I think I have found what I'm looking for. I'm looking for arteriosclerosis. Can you see it here? Can you see it here? Arteriosclerosis, talking about hardening of the arteries. Remember how I explained on how a tumor on the parathyroid hormone can cause an oversecretion of PTH hormone, which will travel down to the blood, to the bones, thereby activating the osteoclast cells to begin to break down the bones. When it breaks down the bones, it increases the amount of calcium within the bloodstream, and this calcium begins to precipitate around the artery walls of our blood vessels, thereby making the blood vessels less elastic. Okay, apart from cholesterol that could cause arteriosclerosis, this is also how calcium, over secretion of calcium within the bloodstream, can lead to high blood pressure. So that's why we are checking here, and you're seeing the readings. For you to know how to interpret this result, subscribe for my online masterclass program. If you want to subscribe, type on the comment section, I want to subscribe, and I will guide you on how to subscribe. Okay, then another parameter I talked about is kidney disease. Kidney disease. Okay, so let me pick this kidney, longitudinal right section of kidney. Then you click on current analysis. I click on the test button. I click on pathomorphology. Okay, and I do my adjustment and adjust all. I do my auto scan to generate the entropy result. Okay, so it is scanning right now, and make sure that the person headset is put on. Okay, so you can see what you are seeing here are different disease names. Okay, let me start from the top. I mentioned a number of them that could trigger what we call that could trigger high blood pressure. All right. Papilloma of kidney is talking about a tumor in the kidney, a growth in the kidney that can make the kidney to malfunction. So it can cause, or it can lead to malfunction of the kidney, which eventually leads to high blood pressure. Okay, diabetes, I mentioned that as one of the examples. Nephroliterasis, talking about kidney stone, that can also be on account of too much calcium within the bloodstream. Okay, fibroma of kidney can lead to high blood pressure. Let me find another one. Idiopathic hypertension can lead to high blood pressure. That's unexplainable cause of high blood pressure. Polycystic dysplasia of kidney can also lead to high blood pressure. Fibromyoma of kidney, and so on. All this can lead to high blood pressure. Now, when it comes to biochemical parameters, the right platform is biochemical homeostasis, and then we are looking at the results. I click on auto scan for it to generate the result on the third column. If you want to understand the interpretation of this result, subscribe for my online masterclass, and you will learn how to interpret this result and put you in command in your practice. Beyond the interpretation, you have access to lifetime coaching. If you have any questions, if you come into any confusion at any point in time, I'm there to coach you for life. You get that? All right. Okay, so the scan is over. So there are certain parameters that we, in fact, even if you check your lab reports, you may be seeing some of them. Okay, look at what I discussed about aldosterone level in the blood. Aldosterone level in the blood. Okay, if you remember all I said about how the adrenal gland will trigger the secretion of aldosterone in the blood, thereby increasing the sodium level, thereby increasing the blood level, thereby increasing the blood pressure level. There are other hormones, steroid hormones, that also regulate blood pressure. So if there's a malfunction, it may affect or it may lead to high blood pressure. You can see aldosterone in the urine. Aldosterone in the urine. Then let me find some other ones. You can see what we call ALT levels in the blood. That's alanine aminotransferase. You can see angiotensin 2. There's what we call the RAS system that regulates blood pressure. That's renin level, angiotensin level. Okay, that's called the RAS system. These are factors that affect blood pressure. Another one is serum ASP, asparaga aminotransferase. These are parameters that even when you run a lab test, a lab scan, they are checking for all these parameters to determine what is going on and to determine whether there will be high blood pressure in the body. So if you look through, the list is long, but I cannot, not to make the video not too long, I've just got to stop here. But these are just to mention a few parameters that can actually lead to high blood pressure. All right, thank you. See you next time.